Tonight on 60 Minutes. What a mess.
At the age of 18, he looked like an old man with no teeth in him.
Our kids at risk.
I begged them not to take them out.
In the dentist chair.
This is just a quick reminder of what the first video is about, how traditional orthodontics, where they extract and retract teeth, is very damaging, not only on the outside but also on the inside. When for years there's been functional orthodontics, which is a much better procedure. The reason this is important to me is because I went through it and I shouldn't have, and I want to talk about, how long this controversy has gone on. It has gone on since the 1880s. They tried to abolish extraction orthodontics back then, and in the 1920s and 30s they did not extract teeth, but now they do it more often, even in this day and age. Even then they knew that it was damaging and they were able to not do it. As you see, this before and after of this girl, before orthodontics and after traditional orthodontics, is very similar to my features. I could have easily had this eliminated and not needed braces, but by the time I went into braces I had a significant overbite, and because of traditional orthodontics my teeth were pushed back so far it pushed my face back and jutted the top part out. And like I said, this has gone on for over a decade, and I'm just going to point out these are my orthodontic records from 1981, a century after the controversy, and the 4 teeth extracted. So why this has continued, I guess, is for these reasons, because anytime I complained as a kid it seemed to just fall to deaf ears, and this is a lot of why.
The General Dental Council is quite clear. It says,
a dentist must explain to the patient the treatment proposed, the risks involved, and alternative treatments.
Yet the Dispatches survey found that 75% of orthodontic patients were not warned that the treatment might not work, let alone that it could cause long-term damage. And 88% were not told about alternative treatments.
I also pointed out this Weston Price research. He did a lot of research on functional orthodontics, and one of them was on identical twins, and he showed the damage that is caused by extraction or retraction traditional orthodontics, and how functional orthodontics has a better outcome, not only on the outside but on the inside as well. So when you remove teeth like this and push them back, it causes damage. If you widen the jaw so the teeth fit better, that's the better alternative. If Mary Kate and Ashley Olsen, who aren't identical twins, ended up looking this different, I think we'd be quite alarmed. Only if your teeth are this jumbled up and maybe you get extractions, it won't affect the way the jaw moves as much. But the jaw needs to be expanded, the palate needs to be expanded, because often that's where the problem lies. And then if teeth are extracted and retracted, it just narrows the palate, which is exactly the opposite of what you want to do. And I just want to play this piece as well, because it explains what happens and why children end up with this problem.
If you look at Zoe, what's caused all this crowding is really not genetics. It's more related to the way she breathes. And if you open really wide there, Zoe, here you go, you can see that narrow top jaw, V-shaped arch.
Dr. Mahoney says the key is to diagnose the problem and start treatment at an early age. And the problem often starts here in the roof of the mouth. When children suck their thumbs or breathe through their mouths, it can be pushed in. And this narrowing can have a knock-on effect. The lower jaw's forced back and down, producing what most of us would call buck teeth.
When I was a baby, I was healthy. But when I was around 5 or 6, I often got chronic strep throats. And when you get chronic strep throats, it causes breathing problems. When children are 5 and 6, their tonsils and adenoids are larger than any other time. They eventually get smaller as you get older. So the problem is very significant in growing children when your teeth are coming out and new teeth are coming in. And that's what causes the problem. I always thought it was because I sucked my thumb. Maybe sucked my thumb caused more strep throats. But either way you look at it, I was doomed. And unfortunately, although I could have had my adenoids and tonsils out, or I could have had early orthodontics, I didn't go in until my adult teeth had grown in. And this is what I should pretty much look like today, but I don't, because my face had become, got to its full growth. And unfortunately, I had a bad overbite. And the way they fixed it was by pulling 2 teeth from the top and 2 teeth from the bottom, putting braces on my bottom teeth first and the teeth behind my extractions, my front teeth last, which I thought was odd. A way you can tell when kids have this problem, it's called adenoid face, and it shows up in the way they look. They kind of have that open mouth effect because of the way the jaws are growing. I had this as well, as you see, and this should have been reason enough to have taken me in for early treatment, but like I said, unfortunately the problem just got worse. And although I had straight teeth, they didn't use functional orthodontics, and it just caused more problems. And then when my teeth got to here, they decided to do a surgery. They didn't understand the balance or the relationship of the jaws and the face, obviously. These are my notes from the surgery I had. And as you see, I look very different profile. I might be a lot older there, but my profile hadn't changed. You can see the x-ray from when I was, obviously right after my surgery. And you see that, it's similar to that. I just want to throw this up because this is a model, obviously, and they have to have symmetry from all angles and look good from all angles. And I don't see my jawline or my nose is, out of proportion or anything. And I just think that that's important to tell people. And I also want to point this out because although I did have damage to my face, at least my nose was straight from the front, but unfortunately, in my later adult life, my 4 front teeth were knocked out and had to be put back in, so they're dead. So that makes that 8 teeth are missing plus 4 that are dead. And I broke my nose. Obviously, you can see this picture was taken about a year before I broke my nose, and this one was taken a year after. I both found these on Facebook, same outfit. But that just shows that. So I just wanted to, make sure that people knew there was a difference before they assumed that that was due to what I'd gone through. And I just also want people to hear this because this is significant. And
I always took my children in early to an orthodontist because I had that, my mother had done that for me, and I was probably in the 60s, one of the earliest children to ever have braces on in the 1st grade. And it was because of my breathing that my teeth were really more protruded than normal. And also adenoids removal, tonsil removal, and braces in 1st and 2nd grade in Atlanta, Georgia was pretty unusual. But it probably saved me down the road.
So she had all that done before I was even, 8. I don't know. It was way before I'd had those things done. This I want to show you is a girl has a journal.
Hi guys, Carrie here. Hey. You guys that have been following my videos know that I've done a lot of talking about sleep apnea, TMJ, those kind of side effects you can get from extraction orthodontics. Well, today we're going to talk about what happens to the front of your face, your lips, and your chin, how that's affected. You guys all know that have been following my videos that train track braces, especially with extraction, have retractive forces. That means they're going to be moving your teeth backwards. And as a result of the backwards pull, my jaw got pulled all the way back behind my ear, completely in the wrong place. Now,
she has a video journal of everything she's been through and what she's tried to do to keep from having to, or tried to reverse her issues. And, your face might change as you grow, but it's not going to change that much. You're not going to know anybody who's had their features change that much, and if you do, it's probably a health problem. So people need to be aware of what's going on, and when I do another video, it'll be on the health problems that happen to children and are not diagnosed, and then what happens to children when they get the wrong treatment and how it's significant to their health. Thank you for listening once again. Bye.